this is just the beginning.
Welcome to this Axios virtual event, Hard Truths Healthcare. I'm Mike Allen, a co-founder of Axios, coming to you from Axios HQ in Arlington, Virginia. We thank YouTube for making this conversation on systemic racism in healthcare possible. We welcome our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. We'd love for you to join the conversation on Twitter at Axios, #Axios Events. I'll be joined by my colleague, Hope King, as we talk about some of the historic health inequities and injustice in medical research that we've all seen come to the fore in this COVID moment. Our first guests are Andy Slavitt, White House Senior Advisor for COVID-19 Response, and Dr. Cameron Webb, White House Senior Policy Advisor for COVID-19 Equity. Andy Slavitt, Dr. Webb, welcome to Axios.
Thanks for having us, Mike.
So this is a first for me. Andy Slavitt has an MBA. Dr. Cameron Webb has a JD and an MD. So we're definitely covering the waterfront, as my grandma would say. Andy Slavitt, one of the questions that you most frequently get asked, and you've seen it all, you ran Medicare and Medicaid for President Obama, is when am I going to have access to a vaccine, right? All politics is local. I know the administration has worked very hard to move up that timeline. Where are you at?
Boy, those days of January and February when there were long lines, when nobody could qualify, when only 8% of seniors had gotten a vaccine shot, which was the case when we got here on January 20th, they seem like so long ago because as of yesterday, Monday the 19th, every adult American is now eligible to go get a vaccine shot. And it's a day that I know millions and millions of people have been waiting for a long time because it means they can hug their family members again. It means they could stop living in fear. It means they could begin the process of beginning to participate back in normal life again. You know, we have increased the number of vaccines that are out in the field. We are doing, we did about 4 million vaccines per day over the weekend. Each day we're averaging over 3 million per day. And there are now vaccine shots available for folks. They can get online and make their appointments.
Now, Dr. Webb, equity has been something that's been very important to the president from the beginning. Just the fact that your position exists says a lot. And equity in access to vaccines starts with equity in distribution. So tell us the most creative thing you've done, try and get shots in arms that might be hard to reach.
Well, remember that when we started back in January, there were about 8.6 million doses a week going out, really just through the states. And so what the administration's done is we built new channels, new venues for vaccination, because we know that people have to have spaces that work for them to get vaccinated. And so we created really 4. There's our mass vaccination sites, the community vaccination centers, and those have vaccinated at this point over 3 million folks, really predominantly persons of color in communities that have been really hard hit and high risk. We've got our retail pharmacy program, which is enabling us to get vaccine within 5 miles of over 90% of Americans. And then we've got our federally qualified health centers program, which I'm very proud of. I used to work at a federally qualified health center early in my practice, and I know how critical they are in communities. And so the ability to get vaccines to those community health centers has been critical. You add on top of that our mobile vaccination units. That really is the most nimble, gets vaccine into places. As I always say, you don't ask a fire to make its way to the water. You bring water to the fire. And between these 4 different venues for vaccination, that's what we've been able to do. And we're doing it in a way that's always centered on equity. And the data bears that out. These mechanisms have been effective at really getting vaccine to some of the hardest hit, highest risk communities.
Andy Slavitt, to anybody who follows healthcare policy at all, you're one of the best known names. I mentioned you've been active in this field for a long time. As President Biden ramped up, what was some of the philosophy of how equity was stitched in to your COVID-19 philosophy? Like the big thing was results, but you've also been thinking about talking about equity from day one.
It's a great question because my experience is that real leaders model the behavior that they expect from others on their team. I don't think I've had a conversation with the president or the vice president where they haven't asked, how the things we're doing are affecting the hardest hit Americans, people who live in remote places, people who have historically been disadvantaged. And, I think it's the president's ethic to do that. I think he also brings a brand of clear, calm leadership that is without drama, without self-aggrandizement. He really expects us to give people the straight facts. He trusts the American public to actually make their minds up for themselves if we present them with the straight story. Oftentimes the news is going to be good. Sometimes the news is going to be challenging, but he doesn't expect us to pull any punches because he trusts the American public to make the kind of decisions that will help us pull together and pull out of this pandemic. And so that kind of consistency, that kind of transparency, that kind of focus on equity, particularly the people who have the most challenges, just sets the tone for people like Cam and I to do our jobs.
Dr. Webb, all through your career, you've been very focused on marginalized populations, underserved populations. You live in Virginia. What has your lived experience told you about the challenge of reaching everybody we need to reach with these vaccines?
Well, I live in Virginia now, but I always tell people my training has taken me from Virginia to North Carolina to Chicago to New York, Baltimore, DC, and back to Virginia. And so my lived experience has taught me that, there's no one way, one size fits all mechanism to do equity. It's inherently local. You have to get down to that very grassroots level, understand what communities need, listen to those local leaders because they know best in terms of what the needs and concerns are. And so you have to have that humility when you step into spaces to know that they know the best path forward. You just have to be supportive, you have to be engaged, and you have to be willing to be creative. And I think that's what's been really important. I also know that, equity work doesn't happen overnight. And so you have to be tenacious. You have to keep pressing forward. And I think that's what's great about this Biden-Harris administration. I think they understand that there is this sprint of COVID-19 equity, of working really hard to make sure that everyone can be vaccinated. But there's also that long game of making sure that racial justice is a priority, making sure that we're serving rural communities in a very real and meaningful way. And so all of the work we're doing around COVID and COVID equity is dovetailing with longer term work through the Domestic Policy Council, through the different agencies and offices. So really critical to keep in mind. There's both a short game and a long game, and we have to be in it for the long haul.
And Dr. Webb, I know that a part of the design from the beginning has been a White House emphasis on public education programs. What have you done there that's creative, or what has been done there that future campaigns on public health will be able to learn from?
Well, one thing that I'll say is that we've been really intentional in the design to make sure that we're centering the voices that need to be heard, that are often left out of conversations. From the very design of our public confidence campaign, we've talked about community voices, community leaders being at the core. And I think our community core is a great example of that. If you look at when it launched, it was really people from communities who are leaders in these communities getting the resources to then reach out and be those messengers. It's not a top-down approach, but rather it's using the resources and the resolve that the federal government brings to support those local leaders in spreading the word and being trusted messengers. And I think that's a good model moving forward. It's a good model to acknowledge the strength, the power, and the potential of engagement at a very local level and creating these avenues to do just that. So I think that's one of the real strengths. And I think the other is using data, using science throughout. Science guides our public confidence campaign through all of, survey data, but real deep engagement in terms of what people are concerned about, what their hopes and fears are related to vaccination or this pandemic more broadly, and to address those head on. And I think that's been a key, really anchoring ourselves in science, anchoring ourselves in community. I think it's a good way to lead.
Andy Slavitt, there's been a lot of publicity around the pause on the Johnson & Johnson vaccine. And I know at the beginning there was worry about what this would do to public confidence in the vaccine. How have you tried to deal with that? How have you tried to mitigate that understandable reaction?
Well, actually, before I go, I'd love to give Dr. Webb a chance, just because you see patients every day and have seen them over the last few days, and that I'm happy to add on to that.
Yeah, absolutely. It's been interesting being in the hospital, since this news broke. A lot of patients and a lot of staff here in the hospital come up to me and said, well, what do you think about this Johnson and Johnson dynamic? But rather than it shaking confidence, what I'm hearing from a lot of people is that, in fact, they're seeing 6 cases out of 7 million doses, and they're saying, wow, that's a real abundance of caution from you all. You're really putting science and safety first. And I think that people were surprised in some instances to see that out of their government, really being transparent and being really focused on safety and science. And I think that I've gotten really positive responses from folks about this, and it's really opened up the conversation. So I think it's really interesting to see how the public is responding to this.
Yeah, I think if you trust the public, you give them the information they need, unadulterated, and you will allow them to do their homework for themselves. This is a very rare occurrence, extremely rare. We also have the good fortune of having other vaccines that don't have any recorded experiences like this, and those shots are available. We have planned for multiple contingencies, and we just need to let science do its time. The committee will do its investigation, and we need to let them do that. But in the meantime, trust the American public to understand that we're putting the facts in front of them, and they're going to make the best decision for themselves and their families. And ultimately, that's going to mean that they want to save their lives. They're going to want to get vaccinated.
And as we say goodbye, Dr. Webb, if you look at the timelines, including this new news for access for everyone, you can look at the administration's timelines and say that you've tried to underpromise, overdeliver. How deliberate is that? And how do you feel like you're doing?
Honestly, I feel like we're just trying to shoot people straight. I think that what this administration has done has been transparent and candid since the very beginning. And if that looks like under-promising and over-delivering, then that's just the outcomes that we're seeing. And I think more than anything, the American people have rallied to this. That refrain of "we can do this." This is the American people stepping up, getting vaccinated, helping their neighbors and friends get vaccinated, fighting mis and disinformation. And so I think that what we're seeing is really not just a whole of government effort, but really a whole of nation effort to get through this pandemic.
And Andy Slavitt, what will success look like to you?
Mike, I'm going to land where you started, which is that this is all about what's local. This is about giving people back their lives after what has been an ungodly, painful experience in so many ways. And, when we give ourselves the proverbial virtual high fives here, it's when we see the day when the Navajo Nation had no reported cases, when we hear of nursing homes that are where people are getting reunited with their grandparents and their parents for the first time in a year and beginning to take that step back. That's the commitment that President Biden made when he ran for president, when he took office. That's what he expects each and every one of us. People like Cam and I are expected to get a lot of sleep until we can make that the case for the rest of the public. And we're not there yet. And I hope everyone has just the patience to see this through, because we are getting there.
Dr. Cameron Webb, Andy Slavitt, thank you for your vital work, and thank you for joining Axios.
Thanks for having us.
Thanks, Mike.
Thank you to YouTube for making these conversations possible. And now we have a View from the Top segment with my colleague Yolanda Brignoni, Vice President of Communications at Axios. Yolanda?
Thanks, Mike. Now joining us from Kansas City, Missouri, the Director and Global Head of Healthcare and Public Health Partnerships of YouTube, Dr. Garth Graham. Hi, Dr. Graham.
Hi, Yolanda.
I want to thank you so much for joining us today for this really important conversation.
Oh, thank you for having me.
Well, I'd love to start off with asking you a little bit about your background in the healthcare industry and how it prepared you for this role at YouTube.
Yeah, Yolanda, I have had about 20 years or so in the healthcare industry. I'm a clinical cardiologist by training. I did my medical school at Yale and did my training at Mass General and Johns Hopkins. And then in addition to clinical practice, worked in public health and health policy. I was a deputy assistant secretary for minority health in both in 2 administrations, and then went into research as chief of health services research at University of Florida and Department of Medicine, and then also most recently, before coming to YouTube, was chief of community health for CVS Health. So I've been able to look at health and public health from a variety of different lenses and contexts, from clinical practice, academics, research, and public policy. And that's allowed me to see the needs of the community, the needs of patients from a variety of different lenses. And so has added to what I can do here at YouTube in terms of how we elevate the voices of both science and the community in an engaging way.
As you well know, more people are becoming less trusting of mainstream media and traditional news sources. And so they're going to platforms like yours to find credible information. Is this wise? And what are you all doing to combat misinformation on the platform?
Yeah, I often say, gone are the days when people were looking for information from a flyer or looking at it from a billboard. People want information that comes to them as a part of their daily life, and they want it to be engaging so that they can understand it. And that's where platforms like YouTube are particularly important. Now, it's important that, as you just mentioned, we tackle issues around misinformation, and that's where we've removed over 900,000 videos that have violated COVID misinformation policy. That's a lot of videos. And just in the fourth quarter of last year, another 30,000. And so we're working actively to remove misinformation from the platform. It's also important to replace that with the kinds of engaging information around science and public health that people are looking for. Like we paired the rapper Fat Joe with Dr. Fauci to really help deliver credible information to his followers, that community. And so we've done this, and it's resulted in over 65 million views around this kind of science creator collaboration. And it's just an example of how you can help reach communities at scale with scientific information in an engaging way.
And speaking of information, what would you say to people who are using the current situation with the FDA pausing the Johnson & Johnson COVID vaccine as proof that the vaccines were rushed to market? They may not be safe. They might not be ready for public consumption. Like, what would you say in your role to people who say that?
Sure. So I would first say, to put everything in context, certainly the complications, the thromboembolic / blood clot complications people have been worried about, that was 6 cases out of 7 million doses given. So about a 1 in 1 million chance. But what we've seen is that the process works. The transparency, the government, FDA, CDC being transparent about the concerns, letting the public know, and then making the pause so that they can evaluate data even further. And so I would actually say that though rare, this complication highlights how the process can work well in terms of transparency and information sharing, and hopefully allowing people to make the right decisions for themselves and the community. But certainly I think that it's a rare complication, but the process shows that being transparent with the community helps to empower people to make the right decisions. And that's where platforms like ours come into play, by being able to elevate information around science and public health so that people can make the right decisions for themselves.
So if Johnson & Johnson is an example of sort of science working well and the process being right, for a lot of communities of color, they've experienced the exact opposite. Whether it's Tuskegee or other examples, healthcare mistrust in the healthcare field, particularly for communities of color, is very pronounced. What are you doing in your role to combat that?
Yeah, so this is an area that I've spent a lot of my career, both on the research and the policy side, working and looking at around health disparities. And I'll say is that first we have to recognize the long history of challenges and things that have happened for Black and Brown communities in terms of their interaction with the healthcare system. Tuskegee being one example, but there are many other examples like that. But really part of what we have to do next is think through how we work with trusted messengers from both the clinical community and from the community to help reach people with information. And so in our case, we're working with partners like the Black Coalition Against COVID, blackdoctors.org, and the Kaiser Family Foundation, who are also working with other folks from the community to help bring trusted voices to scale, trusted voices from Black physicians, Black healthcare leaders, but also Black and Brown folks from the community to make sure we're answering the questions that people have. So again, empowering them to make the right decisions for themselves and their communities. And really the trust, bringing an elevated trusted voices is a very important part of that.
All right. Well, I want to thank you so much, Dr. Graham, for this conversation. I really enjoyed talking to you.
Thank you for having me, Alanda.
And now over to my colleague, Hope King.
I'm Hope King, and I'm a business reporter for Axios, coming to you from New York, New York. Our final guest is the Surgeon General for the state of California, Dr. Nadine Burke Harris, joining us from San Francisco, California. Dr. Burke Harris, hello and welcome.
Hi, thank you for having me.
We're super privileged to have you with us, and there's so much to talk about. I want to start with the pause in the Johnson & Johnson vaccine rollout. I wonder if you've seen it impact at all the overall issue of vaccine hesitancy to start with.
Yeah, well, I think that as you can imagine, anytime there is a pause, I think some of the questions for folks who have concerns, I think folks naturally want to understand more fully what's going on. And I think that this process of the CDC and the FDA recommending a pause right now in the use of the J&J vaccine so that we can further investigate these very, very rare cases of the individuals who experienced a clotting problem. I think that's really important for the public to see, that if there is any hint of a concern at all, that we will take the time and investigate it. So this really is the process working the way that it's supposed to work. And we hope that as we move forward in the vaccination process, that the public really can have confidence that we are taking safety as a first priority for the public.
I think it also shows just how differently these vaccines and all of the treatments and the disease itself impacts people disproportionately and in different ways as well. And, if you look at the cases and who they've really impacted, how are you trying to also, and you mentioned a little bit about boosting the confidence here behind the vaccines, but in general, how are you tackling the inequities around vaccine distribution, the treatment of this disease? As we know, there's so much sort of systemic issues and racism that is embedded in the healthcare system.
Well, you just asked the $1 million question right there. California has taken a very thoughtful and strategic approach to addressing equity. And it starts by recognizing that these inequities didn't just come out of nowhere, right? It's not that like COVID vaccine came the COVID pandemic came in at the beginning of last year and brought with it all of these inequities. They were already existing, and they manifest in what we see in the differential rate of infection and death among our vulnerable communities. And so we recognize in order to respond to that, we need to tackle some of these inequities using a multi-pronged strategy. So in California, when we looked at our vaccine strategy, we took a 5-pronged approach, including allocation. So allocating vaccine in proportion to disease burden. We see higher rates of disease and death in our most vulnerable communities. And so we are sending higher numbers of vaccines to those vulnerable communities to proportionally target that risk. But sending vaccines to vulnerable communities alone is not going to solve the problem, right? So we need to address the issues of trust that have developed over decades. And in order to do that, we need to work with trusted messengers and arm them with the resources to be able to connect individuals with vaccines. But on top of that, we need the provider network, right? We recognize that in our vulnerable communities, there are fewer healthcare providers. And so we need to make sure that we have enough vaccinators in our vulnerable communities. And then on top of that, we got to address misinformation. So we have to have a public education strategy. And the final piece, which is critically important, is that we have to track all the data and continue to course correct as we go along, because addressing issues of equity is not something that is simple or that is going to be overcome overnight, but it requires a dedicated commitment and it requires resources. And that is what California has been putting behind this effort.
And that trust has to happen in so many of the places that you mentioned, not only from the communication perspective, but then also the final step of administering it and building those relationships with those communities as well. And in that way, I want to talk about your role. You are the very first Surgeon General in California. Talk to me about the significance of putting this role into place back in 2019 and being really among the handful of those, in the country who are leading these initiatives at a state level.
Well, I have to say, I think Governor Newsom was prescient when he created the role of State Surgeon General for the state of California, and particularly when he empowered me to be a public health communicator, to be an advisor to him and the administration and to my colleagues across the board and in Health and Human Services, because I don't think any of us had any idea that we would be facing the greatest public health challenge of our era. And I'm really grateful to be able to serve in this moment. I'm grateful to be able to have the opportunity to be part of helping Californians understand how they can support their health and well-being, how they can protect themselves from the pandemic, and also how we can recognize the role that some of these structural factors play in overall health and well-being, right? So I think there's something that we recognize that was almost undeniable in the pandemic that we can carry forward in the work that we're doing, especially around social determinants of health and health equity as we move forward. And that's something that I intend to do as part of my role.
And one part of your past experience and something you're carrying forth in your current role is really to talk more about adverse childhood experiences. And this is something that you've done a lot of research on. For those who are not as familiar, can you explain what it is and why it's such an important issue to talk about?
Yes. So briefly, the term adverse childhood experiences comes from a landmark research study that was conducted by the CDC and Kaiser Permanente now 2 decades ago. And what that research showed was that for individuals who experienced high doses of adversity in childhood, that they had a dramatically increased risk for 9 out of 10 of the leading causes of death in the United States. And we are talking for folks who experience 4 or more categories of adverse childhood experiences, 2.5 times the risk of heart disease, double the risk of stroke, 3 times the risk of chronic lung disease, almost 10 times the risk of, over 10 times the risk of Alzheimer's. And we now understand from decades of research that when individuals experience high doses of adversity, especially during the sensitive period of childhood, that it actually affects our biology and it changes the way our brains and bodies develop. In fact, it can even change the way our DNA is read and transcribed. And that's never been more relevant than right now when we've just been going through this pandemic, which is a time where untold numbers of Americans have experienced really significant adversity. And now that we understand the science about how experiencing trauma and adversity puts our health at risk, right? We can use that science as we move forward in a roadmap for resilience for our nation moving forward.
Yeah, and I mean, thinking about the young children who are in communities that already have issues accessing healthcare at an equitable fashion. I mean, this just really just compounds the case with the pandemic coming up. Really quickly here, not that we need to make the case anymore, but people do pay attention when sometimes dollar signs are associated with the cost. Have you been aware of any research that maybe California has done to look at the economic impact of healthcare issues, maybe particularly here, ACEs?
Yeah, so California, we actually looked at the cost to the state of California of adverse childhood experiences. And this was pre-pandemic. The year that we looked at was 2013. But what it turns out was that adverse childhood experiences, and we looked at the impact on only 8 healthcare conditions, right? But the annual cost was $112.5 billion per year. And that's just for the state of California. So we are talking over 10 years, almost $1.3 trillion, the cost in direct healthcare cost and lost productivity. So it's pretty profound. And we recognize that this is a place where an ounce of prevention is worth a pound of cure.
Well, I'm glad we had the opportunity for you to share those stories with us and the research so that more people can be aware. Dr. Nadine Burke Harris, thank you so much for joining us. She's the California Surgeon General.
It's my pleasure. Thank you for having me.
And thank you all for joining this afternoon for another virtual conversation that has made everyone smarter, faster. Thank you to our sponsor, YouTube, for making this event possible. For more information or to sign up for the Axios AM and Axios Vitals newsletter, visit axios.com/newsletters or on the Axios app. Thank you all for joining, and we'll see you on axios.com.